Good afternoon, everybody. Welcome to the first in a series of webinars to provide an overview to our community about Connect for Health Colorado. My name is Mi-Young Kim, and I am the Director of Communications and Outreach for Connect for Health Colorado. We are thrilled at the participation for this webinar, and we hope that this will be at the beginning of a long and fruitful partnership with our community as we prepare for opening Connect for Health Colorado for our state this October. We have placed all participants on mute, and after we go through our presentation, we will open up the phone lines for questions and answers prior to ending. Our schedule is that we will complete the webinar at 5 p.m. Unless we are able to finish earlier and give back some time to you to move on to all of your other activities. So thank you again, and we'll get started. So this first slide, we wanted to just give you an overview of what is Connect for Health Colorado. We are an open, competitive marketplace for individuals and small employers to shop for health plans, to be able to compare health plans side by side that contain the same base benefits, to determine whether or not you would be eligible for new federal financial assistance based on your income to reduce your health insurance costs, and to be able to get a variety of support to help you make your decision, and that support network would be available by phone, online, or in person in your community with trained representatives. We will get more into detail about all of these aspects, and of course, to be able to enroll in a health plan. To clarify what Connect for Health Colorado is not, we are not a replacement for the current health insurance market or for the agent and broker community in Colorado. We are, in fact, a new way for people to get insurance. All of the ways that Coloradans can get insurance today, they will still have those choices. Connect for Health Colorado is a new option for Coloradans to get health insurance starting in October. Connect for Health Colorado is not engaged with negotiating rates between carriers and providers, and that is part of the structure that was established through Senate Bill 11200. This is a state law that was passed in 2011 that establishes our marketplace to serve Coloradans. Connect for Health Colorado is also not a state agency or a part of Medicaid. We do work with Medicaid and the Colorado Department of Healthcare Policy and Financing, and we do coordinate with them, but we are not part of the same system. We are not a new government healthcare system or a regulatory body. We work closely with the Colorado Division of Insurance, which does regulate the health insurance companies in our state, and we are not an organization that receives funding from the Colorado General Fund. Our planning and initial implementation funding comes from federal grants, and we are required to be self-financing starting in 2015. And we have a diversified and balanced revenue model to achieve that plan going forward. My apologies for that pop-up screen. And to give you more detail about the two shopping paths that are in our marketplace, this slide shows you more detail around the individuals and families side of our marketplace. And to give you, again, some background about how this works, in October when we open, customers will be able to choose 2 shopping paths. There will be one shopping path for individuals and families, and there will be a separate shopping path for the small business community. And we'll get more into the small business side of this on the next slide. This slide talks about who will be our customers. We will be able to serve Coloradans who currently buy insurance on their own, Coloradans who are uninsured, and Coloradans who don't have access to affordable health coverage through their employer. The shopping process will be mainly through the internet, through our new website. But again, we will be providing assistance by phone and in person in your community. When we open, customers will have a wide variety of health plans, and it is important for us to be able to provide a, excuse me, I'm sorry about this pop-up screen. It is important for us to provide a competitive marketplace for our customers, and as our latest understanding is that 10 insurance companies have filed with the Division of Insurance to provide approximately 150 health plan options for the individual and family side of our marketplace, which we are very encouraged about. The final information about health plan features, options, and prices will be available in August. On the types of health plans that will be provided through our marketplace, they will provide comprehensive coverage, and we'll get into more detail about that later in this presentation. Customers will be able to have access to new federal financial assistance. This is in the form of what we call the Advanced Premium Tax Credits, and a program that allows you to reduce your copays and deductibles depending on your income. And this final bullet speaks to the different ways that our customers will be able to get engaged into the shopping process starting in October. In October, when we open, customers will have several choices of options around how they want to start shopping. You will be able to browse health plan options, and that you will be able to do within a few minutes. You can get an estimate of your potential savings through the new financial assistance programs after answering a few questions. You will be able to shop for health plans without applying for financial assistance. And of course, you will be able to apply, fill out the application for the financial assistance, and then decide how much of that you want to use right away to reduce your costs when you pick health insurance. On the small employer side, we will be initially serving small employers with 2 to 50 employees. And to clarify, if you are what we call a business group of 1, or somebody who is starting a business on your own, say you're leaving a large company and you want to start your own business, you would shop through the individual side of our marketplace and be able to access that financial assistance to reduce your costs. On the small employer side, again, we will be initially serving employers, and this is businesses and nonprofit organizations with up to 50 employees. And starting in 2016, we will be serving employers with up to 100 employees, and that is a full-time equivalent calculation. When employers come to our marketplace, they will make the decisions around the group plan that they want to provide to their employees. So they will decide how much they want to contribute to the cost of the health insurance. They will decide how many plans and from which companies they want to offer their employees. So an employer could choose anywhere from 1 to dozens of health plan options to their employees, and this is a major advantage compared to the way that it works today. Today, a small employer can only provide multiple plans from one health insurance company, and through our marketplace, employers will be able to provide choice across different companies and with various plans within those companies. The employees would then be able to come in and make their choices based on the parameters set by the employer. And another additional benefit for the small employers is a tax credit for employers with up to 25 employees who earn on average $50,000 or less a year. Those employers would be eligible for a tax credit that would cover up to half of the total premium cost for all the employees that are covered through that group plan. And finally, one of the things that we want to provide for the employers is ways to make it easier for them to administer these group plans. And so what that means is that we will provide services such as payment aggregation. And what that is say an employer chooses 10 different health plans for his or her employees, and then the employees come in and they choose from those different health plans on a monthly basis. The employer would write a single check to our marketplace, and we would divide up the payments and send those off to the different carriers based on the choices made by the employees. Again, our goal is to make this process easy, and so that employers don't have to worry about making choices and doing a lot of paperwork. We can take on some of that burden for the employer. To go back and talk a little bit more about the financial assistance for individuals and families, we estimate that nearly 500,000 Coloradans will be eligible for the new financial assistance to reduce the cost of premiums. This is a new type of tax credit known as the Advanced Premium Tax Credit. It is a program administered by the IRS. And for an individual, what that means is that if you make between about $15,800 a year and about almost $46,000 a year, you would be eligible for this new type of tax credit. And how that works is that the less money you make on that scale, the higher your tax credit would be. So it is a sliding scale tax credit. And for a couple, that income eligibility is between about $21,000 a year and $62,000 a year. And for a family of four, that eligibility is between about $32,000 a year and $94,000 a year. So this tax credit really applies to, working class families, middle income families, and depending on your income would be a tremendous benefit in terms of reducing your costs, to the point where some people will not have to pay anything for their premium if they use this tax credit up front. It is important to know that the tax credit is higher for Coloradans in that higher age bracket between the ages of 55 and 64. And so what that means is that if you have a 60-year-old person who earns about, say, $30,000 a year, and he chooses Plan X through our marketplace, and there is a 30-year-old person with the same income from the same community who picks the same plan, the tax credit would be higher for the older person, and so they would end up paying the same amount for that plan. So again, this is a way to level the playing field for older Coloradans who do face higher costs for their health insurance. To be clear again on how this works, if a customer in our marketplace chooses to use that tax credit up front when they enroll in a health plan, that benefit would go directly from the federal government to the carrier that they choose for the plan that they pick. So it's not a check that goes directly to the customer, but it is, it's a transfer of funds to the carrier so that that customer would then they would be able to pay less in their premium. There is a second type of a second type of financial assistance. You may hear it as called cost sharing reductions. We call them reduced copays and deductibles. And how that works is for an individual who earns on the lower scale of this tax bracket, so it's between about $15,000 a year and $28,000 a year. That higher end on that bracket represents about 250% of the poverty level. And for a family of four, that is an income of about $58,000 a year. So if you fall within these income brackets, you would be eligible for not only the advanced premium tax credit, but also this reduced copays and deductibles. And what that allows you to do is to essentially get a health plan that would have lower copays and deductibles, and so you would have fewer costs on your end to get your medical care when you go to see the doctor. And here is essentially an example, and again, not using actual rates because we don't have the rates, and that information will be known in August. And just so you understand, I will answer these questions as we finish this presentation. I know that there are some questions coming through on the webinar, and we will get to them as soon as we can. So again, on this example, you have a man who is 40 years old, and he makes $30,000 a year. He enters the marketplace, and he fills out the application for assistance, and he finds out that he's eligible for a tax credit of about $166 per month. He shops for health plans, and he chooses a plan that costs $375 a month. He chooses to use the entire tax credit up front so that when he checks out and enrolls in the plan, the payment that he makes on a monthly basis for that health plan is $209 a month. So again, this is just an example to show you kind of how that process works. Bill, in this case, could have chosen not to use the whole tax credit up front. We will allow our customers to make that choice, whether or not they want to use all of the tax credit, some of it, or none of it, when they are enrolling in the plan. The customer has the choice to use the tax credit up front or to take it off his or her taxes later on when they file their taxes. This slide speaks to the types of services that are covered through all of the health plans that we will offer through Connect for Health Colorado. And what this is all these different categories of services and benefits that the health plans will need to include. And to be clear, this is the minimum set of benefits that will be needed to be included in the health plans. The health plans will be able to offer, of course, additional enhanced benefits as well. But what you'll see here is you will be seeing behavioral health services, prescription drugs, emergency room services, hospitalization, preventive care, and pediatric services. And the purpose of this is to provide a sense of confidence for the customers that when they are looking for health plans, that they will be able to have the healthcare needs met through that plan year. And again, this goes to quality and to, again, to ensure that people can get good quality coverage. For the consumer, just to provide some takeaways here, our marketplace will make it easier for you to compare and purchase health coverage in one place. We will be providing an array of choices, and we will help you make an informed decision by creating transparency around your options. And this is an important aspect of some of the work that we're doing, again, is to make sure that the consumer has as much information possible in simple language so that he or she can make a smart decision and choose the plan that's best for his or her needs. We will be the only place for Coloradans to check your eligibility and for and access the new federal financial assistance that you can use to reduce your costs. And again, we will be offering a statewide network of trained professionals to assist with the consumers. And just to provide you some more detail around that consumer support system, there will be a new customer service center established in Colorado Springs with trained representatives who can help you over the phone and through an online chat function. There will be decision support tools on our shopping website to help you narrow your options and find plans based on, say, the doctor that you want to see. We will have a network of certified health insurance agents and brokers who you can speak to help you look at your options and provide advice about plans based on your needs. And we will have this new network of assistance sites. And these are existing organizations across the state who we will be partnering with mostly through a granting process and a training process to provide community service and to do outreach so that they are available to you in your community for you to go and sit down with and to help you look at your options, understand the financial assistance program, and to apply for that and to enroll in coverage. And so finally, here is some contact information about how you can get more information. The website is connectforhealthco.com. You can send in questions by email. We have a toll-free number that you can call, and that is 855-PLANS-4U. The numeric equivalent of that is 855-752-6749. We have different social media channels, so you can go to Facebook. We have 2 Twitter handles. We have a number of videos that you could look at through our YouTube channel and also a LinkedIn channel. I would like to briefly show you the website for those of you who are not familiar with it. And here is our website that I hope everybody can see, and I wanted to particularly point out the ways that you can connect with us. So here under the Connect link here, you can sign up for emails, and you can sign up as a customer, as a agent or broker, as a business or a stakeholder. You can also request a speaker, and here's a form for doing that. We would like to point your attention to the calendar events. And these are places where you can go to meet with our outreach people. Throughout the summer, we will be adding a lot of events to this site. And we will be adding a lot more information into this Hot Topics area just to give you some educational tidbits around areas where you can learn more about health insurance. There's a video and many, many other features. We have a calculator here so that you can get an estimate of your potential tax credit. And that's here down on the home page. We have one for individuals and small businesses. We also have resources here for people who would need health insurance now. And if you want to get involved with our public meetings around all of the planning activities, we have here a link for the board and the board meetings or advisory group meetings. And that is, of course, an open process, and we invite you to participate in that. I do want to return here to the questions and then open up the phone lines for questions as well. And I hope that this worked. Again, this was the first in our series, and so my apologies. I know there were some pop-up windows there, so again, my apologies for that. And we will go to questions in just a minute. All right, I'm having some trouble looking at these questions. And so I'm going to open up the phone line here. So I think that the phone lines are open. If you have questions, we can go ahead and take them. Were there any questions from people in the audience? Maybe I could get a, is the phone line working? Okay, you know what, I'm going to go to the questions on the webinar. Now I hear somebody typing in there, so maybe I will put it back on mute. You can press *6 if you want to unmute yourself and ask a question. There's a question here that says, what if a single person makes less than $15,500? Do they get financial assistance? And that's a very good question. One of the programs that I forgot to talk about is the expanded Medicaid. And so what's happening in Colorado is that starting in 2014, the income eligibility for Medicaid will expand to 133% of the poverty level. So if you make below that $15,800 a year, essentially, then it would be likely that you would be eligible for Medicaid. So that's the assistance that you would be eligible for. There's a question here about, will you be sending out the PowerPoint presentation? We will be recording the presentation and posting this on our website later this week, and we can also send, if you want to request it by email, we can send that as well. There's a question here that says, how do the tax credits affect the Colorado taxable amounts? Will this impact the Colorado General Fund? So the tax credits are a federal program. There is no impact on the Colorado General Funds. There are no state tax funds used for our marketplace. There's a question here, is income based on total income or adjusted gross income? So the way that the federal government will be calculating the federal financial assistance is based on what they call modified adjusted gross income. Okay. There's a question here. It says, if a person purchases a qualified health plan off of the exchange, can they receive a ladder tax credit when they file their return? For instance, a person does not qualify for tax credit when they file their return in January but loses their job. Sorry, I'm trying to read this. Would they have to reapply?
This is Jim Sugden, by the way, the Small Business Exchange Manager. And for folks that have an adjustment to their credit because their income has changed during the year, they would still be able to have that adjustment take place and they would receive the full credit when they file their tax return. So folks will not lose their credit because they filed under one income and then have their income go down later on. They also have the opportunity to refile and reevaluate their eligibility after they have a change of income. In fact, if their income goes up or down 10%, they are supposed to come back on and re-enter their information for a redetermination of eligibility, and their credit can be adjusted at that time as well.
Okay, and there's another question here that says, thank you, Jim. There's a question here that says, how does coverage work across state lines? Like college students who have co-residents but go to school in another state. Also companies with, I think this is employees in a different state.
Well, it's important for either the individual or the small business, to make sure that they have an array of choices. In the case of the individual, let's say a family, if they know they're going to have an out-of-state student, they want to choose a carrier that has a national network, just as they do now in the outside market. And for business owners who are offering multiple plans from multiple carriers, they want to make sure that if they have out-of-state employees, that they're offering an array of plans that include network opportunities in the states, in the areas where their employees or out-of-state employees are residing.
Okay, there's a question here that says, what happens if Bill gets a raise? And this goes to the example that we provided through the slides. If there is a change in income for a person who has received financial assistance, we would ask that customer to come back to our marketplace to let us know of that change, and we would recalculate their eligibility. Okay, there were a number of questions here around people who make less than those income amounts, and I think I spoke to that question through the Medicaid eligibility, the Medicaid expansion that will be happening. There's a question here that says, we're getting questions about whether Connect for Health Colorado can or will be used for 65-plus-year-olds to purchase supplemental plans to go with Medicare. The answer to that is no. We do not serve people who are eligible for Medicare, we will not be providing the supplemental plans for Medicare. We will, if you do come to us starting in October and you are Medicare eligible, we will help direct you to those programs. Here's a question that says, regarding the tax credit and your slide on cost reduction, you mentioned that the tax credit is higher for Coloradans ages 55 to 64. I get that. However, on the website, the calculator tool shows that the tax credit increases at small increments starting at age 40. Why do you specify ages 55 to 64?
Yeah, this is Jim Sugden again. Without a specific actuarial reference, what I can say is that under the federal arrangement in which the credits are set up, they do increase somewhat at age 55. And I'm going to use a bad analogy, but with health savings accounts, you have the ability to do a catch-up contribution at age 55. There seems to be that same understanding that at age 55, things start moving and they want to encourage participation much more strongly. So there actually is an increase in the slope in the amount of credit when you reach age 55 and up.
Great, thank you, Jim. And then there's a question here about clarifying the small employer tax credit and whether that's different for nonprofits. That the tax credit is up to 50% for a business and up to 35% for a nonprofit?
Correct. In 2014, it will go to 50% for for-profit businesses and 35% for not-for-profits. It's currently at 35% and 25% respectively. The one thing that's interesting about not-for-profit organizations is that they're able to take that credit not against taxes due because they don't have a tax liability, but against the funds that would normally be sent in their quarterly payroll withholding to the federal government. And so they have an ability to take that that relief against their premiums, so to speak.
Great, thanks, Jim. And there's a question here, I think, about business groups of one. What I said earlier in the presentation is that business groups of one are self-employed business owners that they would shop for their health coverage through the individual side of our marketplace. And through that, they would be eligible to get the tax credit and the cost of the reduced copays and deductibles for their health plans. There are many questions again here on whether the PowerPoint will be available, and the answer is yes. There's a question here, what is the certification process for brokers? Okay,
good question. Because brokers are going to have very far-ranging abilities tax within our system, on our online systems, and on behalf of their clients. There's going to be a rather extensive training certification training program. It'll involve 4 hours of pre-work online before they attend classes, and then 16 hours, 2 days, 2 full days of classroom training. It'll be conducted in computer lab environments so that they'll be able to have, brokers will be able to have hands-on training on our systems and fairly extensive training on their ability to act on behalf of their clients in setting up accounts, running proposals, conducting online open enrollments for employees, and also working with individuals in the various functions that need to be worked for individuals in finding out their eligibility for financial assistance and proposing and applying for coverage.
Thank you, Jim. There is a question here. It says 40-year-old Bill says he makes $30,000 a year. How is the reporting of stated income policed, if you will? So our marketplace, we do check with other sources on income, and so we will be doing that in real time as our customers are filling out the application, and so that we will be able to work with the customer around verifying that income and then asking for documentation if there is a difference in the stated income compared to the data sources that we have. There's a question here about, do you have an established appeal entity in Colorado?
We're still,
this is Adela.
Sorry, this is Adela Flores-Brennan, manager of the Assistance Network. We're still working on exactly what our appeals process will be and who will be arbitrating those appeals.
Thank you, Adela. And here's another question. And if they don't go back to the exchange to recalculate their subsidy, how will it be reconciled on their tax return? So I think this question is referring to what if you have a change in income and then the customer doesn't go back to our marketplace to recalculate that. I believe that is a situation that would be handled through the tax return and how the IRS would respond to the information that's filed on the tax return.
Now, you know, if someone has an increase in income, they are required to report it so that their financial assistance can be adjusted. And if they don't, the IRS does have enforcement capabilities to recover a portion of that financial assistance that really is unearned, if you will. So we will be notifying and encouraging, obviously, participants who have changes of income to report those so they avoid that letter in the mail that might come a year or so later once IRS has reconciled all the records.
Thank you, Jim. There's a question here. It says, any update on how this affects CICP? And I believe they're talking about the Colorado Indigent Care Program.
As far as we know, and this is definitely a question for the Department of Healthcare Policy and Financing, as far as we know, there will not be any changes to CICP, although a lot of the individuals who are currently eligible for CICP would be eligible either for expanded Medicaid or for tax credits in the marketplace.
Okay, thank you, Adela. There's another question here. It says, are there cost reductions for a parent-child combo, or a parent with 2 kids, 2 parents, and 1 child, etc.? So the answer is that the financial assistance is for individuals, couples, and families. And so we would take into account your income information, the size of your family, as we're working through that determination. Yeah, it's based on, and just to provide some more detail, it is based on what we call your tax household. So it's, that includes the people that you claim as dependents on when you file your taxes. Okay, here's a question. Are you announcing the topics for the upcoming webinars in this educational series? So we are starting off with these general overviews allowing for Q&A. We will be providing more specific webinars for different topics, and we're working on them. And of course, we welcome your suggestions on what you think would be of most interest to you and your community. Okay, here's a question that says, are brokers agents are going to be able to verify income eligibility? How? What kind of info will these agents have access to?
Okay. Actually, what's going to happen is that brokers or agents can assist if their client wishes them to in helping people walk through the various eligibility criteria. And it really is the decision of that particular client whether they want to have someone work with them and have access to that information. At the same time, brokers have had that kind of access and have very strict limitations and regulation and penalties for inappropriate use of that information. So in a way, the process that's been going on now with brokers being trusted advisors and having access to sensitive financial and health information is being continued out into the future with all the same requirements, restrictions, and penalties if there were to be misuse.
Thank you, Jim. There's a question here. It says, can a person apply for coverage on the exchange even if they don't qualify for a subsidy, or would they need to apply off exchange and only subsidy eligible can apply on exchange? This is a very good question, and this goes to, again, one of those first slides where we talked about who can shop for health coverage through our marketplace. And we are for, we will serve people who are eligible for the new federal financial assistance and for people of any income. We want, our goal is to provide a high quality service for Coloradans who are looking for health insurance, and that is regardless of their income. And we want to, again, just provide a variety of options and appeal to anybody who basically needs health insurance. Okay, here's another question. Can an employer still offer just one plan on the exchange? Do they have to offer multiple carriers?
No, employers have actually 4 options. And the first of those options that were approved in policy by our board was for the employer to select one plan from one carrier to offer on the exchange, and that's a very real option. The second is that the employer may offer a choice of plans from one insurance company, the plans that exist on the exchange, from only one insurer if they wish. The employer may also offer one metal level, like the bronze or the silver metal level or the gold metal level, to their employees, which would involve all of the carriers in that metal level. Or they may offer 2 adjacent metal levels, like silver and bronze or silver and gold, 2 adjacent metal levels and all the carriers that reside in those levels.
So there's a broad choice. You could choose just one.
Broad choice, and it also could be as narrow as an employer would like it to be, offering just one plan from one carrier.
Okay, great. Thank you, Jim. The next question I'm looking at here is, can an individual enroll online in Spanish? And yes, I believe that the answer to that question is that we will have a Spanish language shopping portal for our customers. Okay, the next question. Can you define a small group for us? If there are multiple locations for one business, but they have their own tax ID numbers, are they each considered small groups, or are they combined under IRS rules as one large group?
Okay, that is a good question. So I'm going to give you an answer that we are trying as best as we can to emulate the rules that are in the marketplace now. And but this may be one exception to that rule. We know that groups that have different tax ID numbers currently but have common ownership of their businesses can be combined as one large group by many insurers. But we are envisioning, at least in the shop, that each group with a separate, distinct tax ID number would be a separate and distinct group, that we're not combining in that way. So it depends a lot on the employer's situation, but if you had 4 different businesses with separate tax ID numbers, at this point we don't envision combining them in the shop Now, this is not to be confused with the rules about aggregating businesses for penalty purposes for large employers. That would still apply, but from a shop standpoint, we would treat each of these groups as a separate entity for our purposes.
Thank you, Jim. And just to clarify, when he says from a shop standpoint, we're talking about the Small Business Health Options Program, right, which is a service for small employers through our marketplace.
Correct.
The next question here is, can you talk a bit more about the training required for service representatives and brokers?
Well, let's split those up for a second. I'm going to address brokers, and then we can talk a little bit about service representatives. When you say service representatives, I would imagine that you're thinking about our in-house customer service staff, although we'll also have a really significant and robust, as they say, assistance network of folks that will be working. So first of all, brokers and in-house customer service staff will receive much the same training. They're going to be trained in the basics of the exchange operations. They're going to be trained in security and privacy rules that apply to all of our exchange systems and consumer protections. They're going to be trained in understanding the individual and small group marketplaces and how they function within our exchange systems and structure, how those accounts are set up on behalf of individuals and employers, how proposals are prepared, what the proposal and the application process involve from the shop, the small business exchange standpoint, what's involved in an open enrollment, in providing all of the options to employees and getting them to respond either in a paper format or largely in an online format, which we're encouraging. And then from that point, how cases are put into effect and the interaction between the small business exchange and the insurers and the individual exchange and the insurers. And then finally, ongoing customer service functions that can be handled through our online portals. So there's a fairly extensive process that will be involved with the training. And that training, as I mentioned before, will have 4 hours of online pre-work before someone attends classes, and then have 16 hours of classroom training.
And for the service center representatives, there will be training, both all the things that Jim described, but also things that are very specific to providing good customer service, to ADA compliance, to cultural and linguistic access, and those types of issues. And then the same goes for the assistance network. They will be trained on all of the basics and the overview and the regulatory schemes, and then the individual and shop portal, depending on whether they are serving both the small group market and the individual market, and then also the customer service curriculum. The assistance network will receive that customer service curriculum as well.
Thank you, Adela. Thank you, Jim. So I know we're running out of time here, but I want to keep getting to these questions. The next question is, do people still get premium assistance based on income if a small employer offers them coverage, either in the shop or individual?
Well, thanks for separating those into both the different branches. It's not the intent of the program and of SB 200 to dismantle in any way or to discourage the employer-supported system, which covers a large number of people in the state. And so that's why that system is encouraged through the federal law with tax credits for small employers. However, anyone who is eligible through their employer for minimum affordable coverage would not be eligible to receive financial assistance if they decided to shop through the individual exchange. On the other hand, if an employer wasn't offering coverage or wasn't offering minimum affordable coverage, then they could be in a small, if they work for a small employer, they could go to the exchange, and small employers generally are not subject to penalties. But that minimum affordable means that they must meet at least the bronze level of minimum coverage, and also the affordability is that their contribution for employee-only coverage as an employee is no more than 9.5% of their income.
Great. Thank you, Jim. The next question is, do customer service reps have to be licensed to sell insurance? And so I believe the answer to this is that we will have a variety of levels of expertise in the customer service center regarding our representatives, and they may include some that are licensed and others that are not.
There will be, as part of our policies, which support the broker community as well. We have policies that brokers will participate and be encouraged to be in both the shop and the individual exchanges, and they'll be marketing partners with us. But then no one will be forced to use a broker. So consumers are free to make their own decisions about these things. And we will have a number of licensed service representatives who will be able to assist them in performing the functions for people that say, I need some help in selecting a plan.
Great. Thank you, Jim. The next question is, do we know when broker training will become available?
Yes, our timeline for that is that at or around July 15th, we will be sending out a notification to brokers in a number of different ways. The brokers that are on our mailing list, if you're not on our mailing list, please check our website and ask to be included in our list. They will receive an email from us indicating that they can go to a link online and register for training for classes. We'll also be sending that notification out through major associations that involve brokers, like NAIFA, like CASHU, like CGIA, those are sort of, and of course the independent property and casualty agents as well. And so there'll be a notification around the 15th of July about training availability. We expect training to start around the 15th of August and go through November or until we have the brokers that have applied for certification properly run through the training program.
Okay, great. Thanks, Jim. So I am seeing many, many more questions on this list, and so I don't think we're going to be able to get to all of them, but we will do our best, and we certainly will be able to answer them in writing after we are done. I'm looking through here on the questions, and here, let me, for the folks at the end here, I believe, I'm going to start from the bottom here, and again, like I said, we will answer the questions in writing as well. One of the questions that says, you said rates and plans will be ready in August. Is this early, mid, or late August? And again, this is depending where the Division of Insurance is the entity that will be going through the review process, and so when they are finished, then we will be able to know, but we're hoping in early August. Okay, let's see. Will you offer HSA plans?
Yes, actually, there have been a number of HSA plans. Now, of course, Division of Insurance is still looking through the various programs to make sure that they qualify both on a benefit and a pricing level, and that the pricing is appropriate and adequate, is fair and adequate, and that the benefits meet the criteria for the metal level in which they've been filed. However, assuming that a number of these plans are approved by Division of Insurance, we have both HSA and HRA plans that have been filed for use in the marketplace.
Okay, there's a question here. It says, thank you, Jim. There's a question that says, will you be creating an FAQ on questions from this presentation? So there are many of these questions are addressed through the FAQ on our website. We will continue to update that to reflect the common questions that we are receiving. And again, as we go through this, we've got 4 more minutes here. Will there be Medicaid for people on SSDI who do not work? Right now they have to be employed. We'll have to get back to you on this question. And this is, again, not a question this would be a question for healthcare policy and financing. And there's a question here, will there be a webinar for assistant site managers? We have many forms of communication and assistance that we are planning for our assistant sites and for our hubs, and so you should have already started receiving communication. And Adela, if you have anything more to add to that?
Yeah, as of Friday, we sent out our communication to our assistant sites, letting them know about webinars that are both open to the public, like this one, and then also some that we are planning that are specific to couple that we've scheduled so far on topics that are relevant to assistance sites and hubs in terms of your financing and evaluation and monitoring. There will be more upcoming on outreach and marketing, and then we will be scheduling some that are very similar to this webinar specific for our assistance network, and those we're getting calendared now, and we'll be sending out those invitations and calendar notifications here in the coming weeks.
There's a question here that says, will a broker be able to enroll Medicaid eligible?
We don't anticipate brokers making Medicaid enrollments. And actually, Medicaid enrollments are handled through a system designed specifically for that works in conjunction with healthcare policy finance and the counties. And so what we are going to be training on is warm handoffs and collaboration that will allow brokers who have folks eligible for Medicaid to assist them in finding the right portal and the right place for them to be managed properly, handled properly.
Great, thanks. And there's a lot of very specific questions here. There's one on who administers COBRA if they leave an employer.
You know, we don't anticipate really a difference from the present COBRA structure in that many employers have their own process for administering COBRA. The small business marketplace is not going to actively engage in COBRA administration. However, I think employers and, of course, brokers, advisors of all types in the Assistance Network and our customer service representatives are all going to be aware that now we have this other option that surfaced as of January 1st, 2014, in which people who are still eligible for COBRA may decide to shop on the exchange during an open enrollment period and participate in marketplace-based products, and with or without subsidies, depending on their financial situation. So COBRA, in a way, it was going to stay in place, but there'll be expanded options beyond COBRA now.
Okay, great. It is now 5 o'clock, and we appreciate your participation and all of your questions, and we will answer the questions and send them back. And also, again, like I said, we would post the presentation on our website. And please, keep in touch with us. Let us know how we can partner together as we get ready for our opening. Thank you again for participating, and we will be back in touch as soon as possible. And we look forward to working together. Bye-bye.